Hello everyone and welcome to our final lecture on chapter 17 on section 17.5 on inflammation and fever. Now when we talk about inflammation, of course it's referring to our inflammatory response. It's going to be triggered by a bunch of chemical mediators and cells responding that need to take place when our cells are damaged or stressed or when we have a pathogen that is within our tissues. So having inflammation take place allows our cells to be recruited, and we can then work to eliminate the pathogen, remove any damage and dead cells within the area, and start repair mechanisms. Of course, when we have excessive inflammation, it could be severe and even deadly. So let's talk about those processes. And first, mention the learning objectives we'll be able to achieve after listening to this lecture. We want to be able to identify the signs of inflammation and fever and explain why they occur, and explain the advantages and risks posed by inflammatory responses. So we'll start with the acute inflammation process. This immediately takes place after we have been injured. We get vasoconstriction that first takes place to minimize any blood loss within the area. So here in this figure, you could see that there is a wound. So we vasoconstrict, conserve that blood, and then once we feel that the blood loss is not a threat anymore, the blood vessel, the capillary here, is going to vasodilate and increase vascular permeability. And that is going to take place because the cells here are going to release histamine. And we've talked about how histamine is going to allow for increase in blood flow, and it can also dilute toxins from the microbes. And we now are able to move these white blood cells in so that we can get an influx of phagocytes, namely the neutrophils that are going to come to our defense first. We also have bradykinins released, and that maintains the vasodilation of our blood cell here and increasing fluids to the affected area. Now, all of these things are going to trigger our 5 cardinal signs of inflammation. Most of you know the first 4. It's going to be redness or erythema because of the blood moving to the area. Then we get edema or swelling because we have so much fluid in the area that we get swelling. Heat, again, because of the blood in the area that carries heat along with it. Pain, because of the extra fluid in the area, we're going to get nerves that are going to have pressure put on them that then gives us that perceived pain. And lastly, altered function, because the tissue within this area is no longer going to be able to function correctly. Now let's talk about chronic inflammation. This is going to happen when acute inflammation is unable to clear a pathogen, and the wounded area may heal at the superficial level, but the pathogens are still within our deeper tissues. So it could be involved in progression of degenerative neurological diseases such as Alzheimer's or Parkinson's, heart disease, or metastatic cancer. And it can lead to what we call a granuloma formation. A granuloma, which you see pictured over here, is where we have pockets of infected tissue that have been walled off and surrounded with white blood cells. So this image here is actually taken from someone who's suffering with tuberculosis. So we call this a tubercular granuloma or a tubercle. Another disease in which this can happen is in hepatitis C infections and liver cirrhosis. And the white blood cells surrounding this area are mostly going to be macrophages and other phagocytes that are trying to fight the pathogen, but unfortunately, they are typically unsuccessful, and hence it leads to that chronic inflammation. Now let's talk about fevers. This is going to be an inflammatory response that is extending beyond the site of infection, because a localized fever is kind of what we have as that cardinal sign, heat, right, in inflammation. So when it's beyond that, we're going to cause a total increase in body temperature. And this is done through pyrogens, and it could be endogenous or exogenous. So our endogenous pyrogens are going to be our interleukin-1, interleukin-6, interferon gamma, and tumor necrosis factor. So We'll also get some exogenous pyrogens, and that is released by our LPS within our gram-negative bacteria. That causes our leukocytes to release those endogenous pyrogens that we just talked about, which then can release prostaglandin E2, which communicates to our hypothalamus that we need to change our body temperature and essentially kicks up the thermostat and increases our body temperature. And when we increase our body temperature, it stimulates our white blood cells to kill pathogens and may inhibit the growth of a lot of pathogens because their optimal growth temperature is 35 degrees Celsius or 59 degrees Fahrenheit. Having that higher temperature can also release iron sequestering compounds from our liver so that we are limiting the iron that's available to our pathogens, and essentially it starves the microbes. We may also start shivering, which will help increase our body temperature as well. Now, after we've had this fever for a while, we might have that fever break, and this is called the crisis phase. And that happens because we get vasodilation of our blood to our skin, which allows the heat to radiate off of our skin, cooling our body down and triggering our process of sweating. And that, of course, is going to evaporate off of our skin, cooling our body down as well. And what we need to be careful of is when we are infected with super antigens, these are associated with very high or life-threatening fevers where it's excessive, going to like 42 degrees Celsius or 108 degrees Fahrenheit, because it can cause damage to our tissues and our organs. It activates our T cells excessively and overstimulates that inflammatory response. And let's talk about our resolution of our clinical focus on Angela. The doctor now is suspecting that she has hereditary angioedema, which is a genetic disorder that comprises the function of C1 inhibitor protein. And when we don't have those C1 inhibitor proteins functioning properly, we can have overstimulation of the system that leads to a production of inflammatory anaphylactoxins, which can result in swelling and fluid buildup in tissues. And in Angela's case, this is happening to her respiratory tract. So she can have these occasional episodes, and unfortunately, it is not responsive to steroid treatment. But now that she knows what the issue is, they can act swiftly. So the doctor orders a more specific blood test and functional assay of C1 inhibitors, and that test showed that deficiency in C1 esterase inhibitors, which are the proteins that help suppress activation of the complement system. So in the future and right now, they can use purified and concentrated C1 INH from blood donors in order to make sure that the complement system can be suppressed and not become overstimulated.